Dr.K.Ganapathy, Neurosurgery in 2030, a peep into the future.
Good morning, everybody. Thank you, chairpersons. Some of us are afraid of the future. We cling desperately to the present, not realizing that we have already become the past. In the next 900 seconds or so, I intend to put you on a time machine and take you with me on a journey. There will be turbulence along the way, but I guarantee you a safe landing. I could not resist the temptation of inserting an audio clip. Can I have the audio, please? This was the first talk I gave in 1986, 36 years ago.
Is an associate editor of Neurology India and past associate editor of the CME program of the Neurological Society. He is a young upcoming neurosurgeon of whom we are all very proud. I request Dr. Ganapathy to give his presentation.
Respected Chairman, ladies and gentlemen, when I was first requested to talk about neurological sciences in the 21st century, the first thought that struck me was, fools rush in where angels fear to tread. For I knew that I certainly was not an angel. I'm not an astrologer by training, and it would be presumptuous on my part to attempt to predict the state of the art of the subject in the 21st century. And the first slide, please. Futurism has been defined as a game of extrapolation based on current conditions and trends.
And so on and so forth. Now, before going into neurosurgery in 2030, I think it's very important that we need to predict and see how the world is going to be. When I'm talking about the world, I'm talking about India. This is probably how my parents started their life on the top left-hand side. And I'm absolutely certain that my grandchildren, not my great-grandchildren, my grandchildren will be living in skyscrapers like this. No less, can you switch on this video, please? Yeah, okay. Now, this is not fantasy. A little bird tells me that I am going to see this happen in Chennai. And why am I so confident? No less an organization like IIT Madras have already got venture capital funding for this, and they somehow feel that within the next 3 years, they will be able to do pilot studies on this. Can you imagine an e-plane? This is already commercially available in a few places in other parts of the world. Would any of us have thought that as early as 2022, almost 1% of cars in many states in America are autonomous cars, driverless? So this, ladies and gentlemen, is what is going to happen in the future. Next slide, please. Yeah. When I was doing my residency, we had Yeomans, we had Rangachari, and maybe 1 or 2 more books. But today, the futurology is all about extrapolating current technology into a decade from now. This is the books which are now available. Neuroengineering, Oxford Handbook of Neuroethics, Neuromarketing, and so on and so forth. Subjects which did not exist even a couple of years ago. Principles of molecular neurosurgery. Can you imagine a neurosurgeon who is to be an expert in endoscopy and brainstem biopsies also becoming a molecular neurosurgeon? If this is what is there today, imagine how the world is going to be in 10 years from now. Augmentative neurosurgery is going to be a subspecialty, and I foresee that neurosurgeons of the future will probably also be doing the equivalent of bariatric surgery. They'll be treating diabetes, hypertension, and so on. This is based on papers published in high-index peer-reviewed journals. In 1986, in the previous talk which I had mentioned that with a drop of blood, one day we will be able to diagnose brain tumors. Never would I have imagined that liquid biopsy is going to actually include tumors of the brain. There was a paper published 10 years ago about urine analysis as a biomarker, as a surrogate biomarker for cerebral arteriovenous malformations. I predict that imaging as we know today is going to be replaced, well, not perhaps replaced, is going to be supplemented by biomarkers. Acoustic analysis of voice. Many papers are already there. Acoustic analysis of voice, again using AI, is going to be a tool in diagnosing many neurological disorders. For some strange reason, neurosurgeons have been fascinated by technology, not only in India, but all over the world. This was an article I wrote on metaverse and healthcare, a clinician's perspective. The Metaverse Doctors Association, started by a neurosurgeon. And you can just look at this. It's just a question of time, because what is available in thoracic surgery is extended to neurosurgery. 200 thoracic surgeons assess the virtual environment wearing a head-mounted display. And as the previous speaker so beautifully illustrated, this is exactly what happened 2 years ago. And wearing a head-mounted display in an immersive environment, they could actually get into the atrium, into the ventricle. I'm not talking of one surgeon, I'm talking of 200 surgeons in real time across 5 continents. So this is what is going to happen. Digital twin. I was surprised that digital twins are being used in India for the last 2 years. Simulation of everything. What is a digital twin? A digital twin is a highly complex virtual model of an exact counterpart. That is why we call it a twin of a physical object. It is possible even today that sensors could be put on the physical asset, namely a human being, collect data. The first speaker was talking of the importance of data, augmenting data, and so on and so forth. The digital twin is an exact 1:1 copy of all health data from antenatal to clinical death. Even the Ayushman Bharat is already talking of a universal health coverage. We are talking of the National Digital Health Mission. I foresee that in 10 to 15 years from now, right from the unborn, when you are conceived, your antenatal ultrasound, till you become brain dead, every single interaction with a medical doctor or with the healthcare community will be digitized, and more than that, it will be stored and made universally available, perhaps in an anonymized form. Imagine the next time you get a patient with an unruptured aneurysm, you want local data, and you will be able to get a digital twin of that patient to the unruptured aneurysm with his metabolome, with his microbiome, everything you talk about, diabetes, hypertension, age, genealogy, genetics, and so on and so forth. So this is what is going to happen. Harvard Business Review, 10 years ago, published a paper, Can Brain Scans Help Companies More? How many of you know that professors of neurophysiology of Stanford, Harvard, and such Ivy League universities are today being recruited by Pepsi, Coke, and other companies? After all, at the end of the day, it's all about advertising. Advertising is so crude. In 10 years from now, we will be talking of neurotizing. A lot of papers have already been published on trying to identify what is called the buy button. At the end of the day, a company wants to know, what is it that makes me go to a shop, or rather electronically order something when I see an ad? All of us are familiar with Google Ads. We know the trillions of dollars they are making. And this is already enormous amount of functional MRI work has been done. You can see right from the singular motor area for liking, disliking, and so on and so forth. The amount of papers published in this very strongly suggests that in the next decade, this is going to become a reality. Neuromarketing tools, of course, there are ethical issues, and there are several institutions which are not permitting such studies, but this is self-explanatory. You can see how event-related potential analysis will help you do this. Human body on a chip platform. We all know it takes decades before a drug or a vaccine, at least in the earlier years, comes into phase 3 clinical trials and so on. Today, everything can be simulated. FDA has already approved the first drug made by a 3D printer, which incidentally is an anticonvulsant. Incidentally, personalized medicine, particularly neurosciences, I foresee has got a great future. Many of us do not give enough importance to a genetic profile, and this is going to take over completely. The commonest cause for seizures is not brain tumors, is not CVA, but is non-compliance and non-adherence. So we will have digital pills. The digital pills will keep reminding you. Imagine if all the brains in this auditorium are wired together and are given a problem to solve. I mean, the chances of 10 brains, 20 brains, 100 brains working in real time at tandem. And this has already started happening today across continents. We are not talking of brain-machine interface. We are talking of brain-brain interface. And all these are based on solid scientific data, which I'm talking about. A paralyzed man in Australia tweets using his mind after having a microchip implanted in his brain. The previous speaker told us about Neuralink, and I foresee that in the next 10 years, there will be many, many people with a direct physical telemetric connection to a computer with a brain. A couple of months ago, my niece asked me whether I was chipped. I just didn't understand her. And then I realized that people in Europe have already been chipped. They have printed circuit boards inside them so that they can, they don't have to take out their telephone and use it. The world's first 5G-powered remote brain surgery reported in the literature. Coming back to India, I am delighted that the maximum number of funding given by Department of Biotechnology, I happen to be on some committees of this, so I evaluate these proposals, are from neurology. And I think this very clearly shows that medical devices in India, in neurosciences, is going to become much more. Wearable health monitoring systems, particularly the International Space Station, etc. It's only a question of time before all this extends to neurosciences, and I foresee the day is not far off. We have already funded a similar project, actually, where you wear a cap. You just wear a cap over your scalp, and your surface EEG, telemetric, video EEG connected to a mobile phone, etc. Gone are the days in 2030 of somebody having to go into an EEG lab. Your evaluation will be done purely based on what you are wearing. I don't think it's impossible that we will be able to penetrate the skull. Already, Doppler, we have an acoustic window in certain parts of the temporal bone. You know that it is possible to send ultrasound through an intact bone. It's just a question of time before the skull is no longer a barrier and we will be able to look inside your body. These are all commercially available, incidentally. Apollo Hospitals started about 2 months ago what I think is the first 5G-enabled pre-hospital management situation. And I foresee that in the next couple of years, with 5G being available, head injuries, etc., will be evaluated on-site based on state-of-the-art video and things like that. Robots. Employee of the month in any big hospital will be given to a robot. And all this is happening in India. The COVID made people from 2-tier towns and 3-tier towns, engineering college students whom we would never have thought, have now built robots. And I know several of these robots are already being used in hospitals in Kerala and so on. This was a slide which I got in 2012. At that time, it was extremely uncommon. But I am sad, really sad, that I think this will be the picture in 2030 from now. I've already told you 17 diseases with clear biomarkers in human breath. You breathe somewhere and you will be able to get a diagnosis. And voice biomarkers and so on. This is the hype cycle for emerging technology. We go through all this, a peak of inflated expectations, a slope of enlightenment, a plateau of productivity, and so on. Before I conclude, my white hair probably, wherever there is progress, there are also problems. And I think this fantastic progress in technology is going to lead into problems. And I appeal to everyone in this auditorium not to think only of quality of life, but to think of quality of death. Let us understand that we are not magicians. Everybody is not immortal. Let us accept the fact that your patient is not going to have a good quality of life. I think it is our moral responsibility to ensure a good quality of death also. A couple of years ago, when this special issue was brought out on extraterrestrial neurosciences, there were people who were not very, who thought it was a controversial subject. But in the last 4 years, the Gaganyaan mission of ISRO, which has been postponed because of COVID, likely to take place in 2024, there has been an enormous fallout. ultrasound, wearable ultrasound. This is going to be a reality very soon. Gone are those huge ultrasound machines. You will be wearing a patch and staying at home, and you will be able to peer into the interior of your body. Science and technology, ladies and gentlemen, and clinical care cannot be separated. It has to be together, and I'm absolutely delighted that though late, India has started, and in the next 10 years, we are going to have a direct MD PhD program. IITs will be having medical colleges and so on. So, ladies and gentlemen, what is my take-home message? My take-home message is, if I were the beneficiary in 2030, what would I expect my neurosurgeon to be? Thou shalt digitally transform. If Moses came down to the earth today, all his 10 commandments would be preceded by the word, thou shalt digitally transform. You need to have the surgical skills of Sushruta, which in the last 2 days I've seen, obviously most of you people have this. You must have the compassion of Mother Teresa. I'm not really sure whether this is taught in today's residency programs. You must have the pragmatism of Lord Krishna, who during the Bhagavad Gita has very clearly enunciated the practicalities of life. You must have the genius of Albert Einstein. You must have the innovativeness of the discoverer of Apple, Steve Jobs. All this, of course, probably requires a Superman, but this is 2030 as I perceive it to be. Thank you once again for this opportunity.
Hello. Thank you, sir, for your excellent topic. Thank you. Any question from the audience?
Daljit. Dr. Daljit first.
Dr. Ganapathy, I enjoy every word of excitement which you created in few minutes. And I wish there was a session on a subject like this where more and more issues of similar kind could have been discussed. I'm definitely moved with what you spoke, but then there are certain concerns, obviously, with the advancement of technologies. Now let me touch one by one, and maybe some of them can answer. My big concern is the safety and the explosion of the big data which is going to get collected over the period of time. And we saw one such results in hacking of AIMS recently. You also mentioned about neuroethics, neuromarketing, which was a part of your talk. And I'm quite well aware of it also. The wearable devices, the devices which people are wearing, electronics, wristwatch, controlling the blood pressure and all, very, very dangerous. I can control with my remote control devices from a center your heartbeats. I can produce atrial fibrillations in you, and I can do whatever it can be done. At the same time, there are military applications of these devices where suicide bombers can be trained to go and work in the fields and do whatever they want to do. That's another major concern which is propping up. So breach of privacy, I mean, you can see into my body parts and looking into this. And I mean, are these actually justified from those angles? If we are evolving so many things in the upbringing of neurotechnologies in various institutions, there should be a role of re-looking into from those angles of ethics.
You're absolutely right, and I wish I could give a simple yes or no answer. You're absolutely right. But then, having identified the problems, I'm optimistic that one day we will find solutions, and these solutions will keep changing from time to time, from geography to geography, from culture to culture. It is not a static answer.
Please be very brief.
Yesterday there was a talk on something talked about learning curve. That every new technology, when it comes, there is a time for learning curve. So you learn, and then there are some complications involved in that. So when these technologies will come, definitely there will be learning curve and some complications. So how would you manage those things? Because complications nowadays from the textbooks, etc., we see are becoming less and less, and they are taken more as negligence rather than complications in neurosurgery. So how would it be?
I would view this in a slightly different way. I think that with all this technology, the learning curve, as we conventionally understand it, is actually going to become less and less. The problem is going to be when do you apply this technology, where, why, how, with whom, etc. The actual learning curve is going to become less and less because automation is becoming more and more.
Thank you very much, Dr. Ganapathy.